In the weeks before your surgery, the surgeon's office staff will schedule the date for your surgery. Your surgeon will order tests to be completed before surgery, including lab work, EKG, X-rays, or other diagnostic screening. The pre-admission testing, PAT nurse, will work with the anesthesiologist and your surgeon to ensure that all blood work and diagnostic tests are completed and review them prior to surgery. We will act as your contact between the surgeons, the hospital, and the testing process. You may call the nurse navigator at 831-462-7597 at any time before surgery with questions or concerns about any part of the process or the procedure itself. At this point, you should contact your insurance company to confirm and clarify your coverage and deductibles for the surgery. The hospital will also pre-verify your coverage and determine what your out-of-pocket cost will be. You will be required to pay your out-of-pocket expense prior to admission unless other arrangements have been made. If you have any financial concerns, please contact Registration and Patient Financial Services at 831-462-7280. Stop alcohol consumption to avoid withdrawal symptoms in the hospital after your surgery. Stop smoking tobacco because it inhibits healing. Tobacco smokers may experience pulmonary complications with surgery, and complex cardiovascular events may ensue during anesthesia. Stop the use of marijuana. Patients who routinely use marijuana should abstain for several weeks prior to surgery. The use of marijuana may create an opioid tolerance, making pain control after surgery much more complex. Another complication of marijuana use prior to surgery is a cannabis withdrawal syndrome that varies by each user. This can include craving for cannabis, insomnia, depression, anxiety, and irritability. It should also be noted that hospitals in the USA do not provide marijuana as an inpatient drug because of its federal illegal status, regardless of the state's approval. In the 10 days before surgery, you will have an appointment scheduled with your surgeon during this time for a final checkup and final questions. You may need to have a blood test within 2 days of your surgery. If so, your doctor will tell you. You will be given an armband at the time of this blood test. It is important that you do not remove this armband before your surgery. The PAT nurse will call you a few days before surgery. She will review your pre-anesthesia questionnaire, collect a list of medications, and confirm your surgery time. Get ready for your homecoming. Take care of all the chores and meal preparation. Freeze in single containers so you can come home to frozen meals and a tidy house. Clean and sanitize your bath and shower. Remove or fasten down area rugs so you won't slip or trip. Prepare clear, flat, and wide walking paths throughout your home by removing obstructions or unnecessary objects. Obtain necessary equipment recommended in the preoperative education session. Until you are more independent with daily activities, it is recommended you make arrangements to have help with daily chores, pet care, and medical management for several days after you've been discharged from the hospital. Unless otherwise directed by your physician, stop taking any and all medications that increase bleeding, such as ibuprofen, Advil, aspirin. Supplements such as ginkgo biloba, vitamin E, ginseng, fish oil, turmeric. See page 7 of your complimentary booklet for a complete list. Your surgeons will make recommendations regarding other medications you are taking. Additionally, you should avoid clipping your nails or getting manicures or pedicures for 7 days before surgery. Do not shave any parts of your body 3 days prior to surgery. Please be aware that the time of your surgery may change. Expect a confirmation call from the hospital. No food, gum, or drinking, including water after midnight unless specifically told otherwise. You may brush your teeth. If you are required to take medicine on the morning of surgery, you might do so with a sip of water. Starting 3 days before surgery, wash with chlorhexidine wash with a clean washcloth from the neck down. Chlorhexidine can be purchased over the counter at any pharmacy. A surgery prep kit, which covers 2 showers, will be mailed to you. On the night before surgery, use the first baggie in your Dignity Health surgery prep kit. Read the instructions carefully before starting. Dry off with a clean towel, wear clean pajamas, and have clean sheets on your bed. On the morning of surgery, take another shower using the cleansing solution. Do not use any lotion or perfumes. You will be asked to come to the hospital 2 hours before surgery to allow time for final assessment. Please be on time to help keep your surgery stay on schedule. According to federal law, patients should have the chance to make their wishes known about their health care. Forms for your advance directives are available at no charge at Dominican's Chaplain Department at 831-462-7552. This information is available in English and Spanish. If you already have one filled out, bring a copy to the hospital when you are admitted for surgery. As part of your stay in the hospital, you will want to bring personal hygiene items such as toothbrush, deodorant, comb, comfortable loose-fitting clothes, a copy of your advance directive for healthcare if you have one, your eyeglasses and hearing aids. Do not wear contact lenses. Bring your cell phone and iPad so you can stay in communication with your family and friends. Remember to bring your device charger. Always have a list of current medications with you. If you are borrowing an ice therapy machine from a friend or a family member, please get a new bladder attachment to help prevent post-operative incision infection. Bring your CPAP if you currently use one at home, and your identification and insurance card. Please do not bring medications from home. Also, leave home jewelry or other valuables. Keep your walker in the car for you to have available once you are discharged. We also ask that you please do not wear perfumes or bring fragrances into the hospital. We are honored that you are choosing and trusting the Dominican Hospital for your orthopedic care. We hope you find this information helpful, and we look forward to meeting you and delivering an exceptional experience.